Phentermine in bodybuilding, appetite suppression, energy, and the dark side. Introduction. When bodybuilders diet down, the biggest enemy isn't always training intensity or cardio, it's hunger. Cravings, low energy, and mental fatigue can destroy a cut. This is where phentermine enters the picture. Originally developed as a prescription weight loss drug, phentermine is an amphetamine-like stimulant that suppresses appetite, boosts energy, and makes dieting easier. But in the bodybuilding world, it's a double-edged sword, powerful but risky. Meet phentermine. Class: sympathomimetic amine, chemically similar to amphetamines. Medical use: approved for short-term obesity treatment. Mechanism: increases release of norepinephrine and dopamine in the brain, thereby suppressing appetite and increasing alertness. Effect: reduces hunger signals and cravings, increases mental energy. How bodybuilders use it? Cutting phases, to stay in a calorie deficit without feeling starved. Pre-contest prep, helps bodybuilders push through the hardest diet weeks. Energy during low carbs, keeps motivation and training drive high when carbs are restricted. Short bursts, rarely used long-term, more often used for 4 to 8 weeks in extreme cuts. Dosage and administration. Medical prescription, 15 to 37.5 milligrams, once daily, capsule or tablet. Bodybuilding use, 15 to 30 milligrams in the morning to control appetite all day. Some split the dose into half AM and half early afternoon to prevent late-day cravings. Timing: always taken early in the day to avoid insomnia. Benefits in bodybuilding. Strong appetite suppression, makes extreme calorie deficits tolerable. Increased energy and focus, especially valuable on low-carb diets. Better diet adherence, fewer cravings, less cheating. Synergy with cardio. The stimulant effect helps with endurance. Psychological edge. Users often report euphoria and motivation. Risks. Phentermine is powerful but not forgiving. Elevated blood pressure and heart rate. Insomnia if taken too late in the day. Dry mouth, dehydration. Irritability, anxiety, or mood swings. Possible dependency with long-term use, amphetamine-like. Dangerous if combined with other stimulants, such as clenbuterol, ephedrine, or DMAA. Stacking in bodybuilding. With caffeine, some athletes add coffee or energy drinks, but this raises the side effect risk. ECA, ephedrine plus caffeine plus aspirin, rarely stacked due to high stimulant load. Clenbuterol or albuterol, extremely risky, but some hardcore competitors combine them for maximal appetite suppression plus fat burning. Topiramate, 2-simia. In medical settings, phentermine is sometimes paired with topiramate for stronger appetite control. Risk reduction strategies. Use only short-term, 4 to 8 weeks, to avoid dependency. Monitor blood pressure and heart rate regularly. Never combine with other heavy stimulants unless under medical supervision. Prioritize hydration and electrolytes. Cycle off gradually. Avoid sudden long-term use. Scientific findings. Proven effective for short-term weight loss in obese individuals. Appetite suppression is strongest in the first few weeks, with tolerance building over time. Long-term safety is questionable. Most guidelines recommend limiting to 12 weeks or less. In bodybuilders, the effect is more psychological and adherence-based than metabolic. Conclusion. Phentermine is less about burning fat directly and more about controlling the mind. Hunger is the biggest enemy in a deep cut, and phentermine helps silence that voice. But with its amphetamine-like profile, risks of dependency, and cardiovascular strain, it's not a casual fat burner. For bodybuilders, it's a powerful weapon to endure the hardest phases of contest prep, but it's also one that should be used sparingly, strategically, and with full awareness of the risks.